Okay, so this screencast will cover what living with type 2 diabetes is like, and it's based off a real person suffering from the condition that we interviewed. So, first about the patient. The person we spoke to was an 89-year-old female who not only suffered from type 2 diabetes, but also had COPD, poor circulation, and an irregular heartbeat caused by a hole in the heart. And okay, so what actually is type 2 diabetes? Well, type 2 diabetes is a condition where blood sugar levels become too high. This takes place when the body may become irresponsive or less responsive to a hormone called insulin. This hormone regulates blood sugar levels, and as a result, type 2 diabetics develop high blood sugar, also known as hyperglycemia. The disease, unfortunately, is chronic. However, it can be treated and managed effectively with medication and by leading a healthier lifestyle. So, the most common signs of someone with the disease include feeling a lot more fatigued than usual, needing to urinate more frequently, especially at night, having blurred vision, cuts and wounds that take longer to heal, and unexplained weight loss. Having a family history of the disease or being from certain ethnic groups could put a person at higher risk of developing the disease. Luckily, however, there are many medications available for managing type 2 diabetes. The most common are metformin 500 mg tablets. Insulin injections are also widely used, especially in type 1 diabetics. This is because in type 1 diabetics, the body cannot produce its own insulin. For those living with type 2 diabetes, it is therefore important that they follow a stricter diet aimed at maintaining blood sugar levels, commit to regular exercise, 30 to 60 minutes is recommended, have regular checkups with the GP, and keep a record of blood glucose levels. This is especially important as leaving the disease, untreated or just not managing it may lead to vision loss, nerve damage, kidney problems, or God forbid, heart disease and a stroke.